Cyclosporine before PCI in patients with acute myocardial infarction. Definition: Cyclosporine is an immunosuppressant drug widely used in organ transplantation to prevent rejection. It reduces the activity of the immune system by interfering with activity and growth of T cells.
For our next video lecture on immunosuppressant drugs, we'll be looking at primarily cyclosporine A, but also a little bit at tacrolimus or FK506, due to the fact that they both have an overlapping mechanism of action. Both of these drugs are used primarily for prevention of organ rejection post-transplantation. And the really interesting thing is that both of these drugs are very much structurally different. Cyclosporine A is a fungal metabolite, whereas tacrolimus is a macrolide. Now, normally what happens is we have an antigen-presenting cell, such as a macrophage or dendritic cell, which presents an antigen through an MHC marker and binds onto a T cell receptor and also a CD28 receptor, leading to activation of calcineurin, which is a serine-threonine phosphatase that dephosphorylates N-fat, allowing it to translocate into the nucleus and lead to transcription of genes that lead to production of IL-2. IL-2 is a very important cytokine that leads to clonal expansion of T cells. The way in which these drugs work is twofold. For FK506 or tacrolimus, it binds onto FK binding protein, and for cyclosporine A, it binds onto cyclophilin. Both cyclophilin and FK binding protein inhibit calcineurin. By inhibiting calcineurin, it can no longer dephosphorylate N-fat, and therefore N-fat cannot translocate into the nucleus and lead to expression of IL-2. It is important to note that even though here I only show that these drugs inhibit the pathway that leads to increased synthesis of IL-2, that these drugs will also lead to decreased synthesis of tumor necrosis factor alpha, also decreased synthesis of GM-CSF, and also decreased synthesis of other cytokines. Cyclosporine A has many adverse drug reactions. One that we've commonly seen in other lectures is opportunistic infections, which is an infection that a normal healthy person wouldn't get or is abnormally severe. Classically, and a really important one that you should remember, is nephrotoxicity, which can lead to hypertension. Cyclosporine A can also lead to gum hyperplasia, can cause skin cancer, seizures, and neuropathy. Now we're going to look at the clinical pharmacology of cyclosporine a little bit. Cyclosporine has erratic oral bioavailability, and therefore we administer it in an emulsion formulation. It is really important to note that a clinician has to monitor the blood concentration levels of cyclosporine A when administering it. Another really important thing to remember is that if a patient drinks grapefruit juice, it will inhibit CYP3A4 in the intestinal epithelium, and therefore by inhibiting this enzyme will lead to decreased breakdown of cyclosporine A and increased levels of cyclosporine A in the blood.
Application in medicine: use in organ transplantation, also in severe psoriasis, severe atopic dermatitis. Cyclosporine has also been found effective for some cases of other inflammatory skin disorders, such as pyoderma gangrenosum, dyshidrotic eczema, chronic urticaria, Behçet disease, and pityriasis rubra.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition. Page 209. Immunology, immunosuppressants. What is the mechanism of action of cyclosporine? The mechanism of action of cyclosporine is to bind with cyclophilin, which is a cytosolic protein. This would form the cyclosporine-cyclophilin complex, and this complex blocks the differentiation and activation of T cells by inhibiting calcineurin. And that calcineurin in normal circumstance is what's responsible for activating the transcription of interleukin-2. So therefore, calcineurin inhibition would prevent the production of interleukin-2 and its receptors. What is the clinical use of cyclosporine? The clinical use of cyclosporine is to suppress organ rejection after transplantation, and it's also effective in certain autoimmune disorders. What are the side effects and toxicities of cyclosporine use? Cyclosporine use can lead to nephrotoxicity, hypertension, hyperlipidemia, hyperglycemia, tremors, gingival hyperplasia, and hirsutism. Define hirsutism. Hirsutism is just an abnormal growth of hair on a person's face or body. For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at usmlefasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at usmlefasttrack.com.
Hi, I'm Dr. Andy Thompson, and I'm a rheumatologist. Today, I'm going to talk about cyclosporine for the treatment of vasculitis and lupus. You can visit our website, www.rheuminfo.com, and print off one of our cyclosporine pictorial pamphlets to follow along with this video.
We know that vasculitis can also produce, and lupus can produce acute myocardial infarction. So whenever you want to ask about the vasculitis and lupus, yes, it can cause a myocardial infarction.
Cyclosporine is also known as Neuron. Cyclosporine is given by a tablet taken twice a day. You'll need to discuss the dose with your doctor. It can take a few months for cyclosporine to work, so you'll need to be patient. Now there are 4 things you need to do when taking cyclosporine. You should discuss these with your doctor. First, it's important to get regular blood tests every 2 to 4 weeks while taking cyclosporine. This is to make sure the medication isn't affecting your blood counts or kidneys. Second, cyclosporine can make it slightly harder for you to fight off infections. It's best to stop taking cyclosporine and call your doctor if you have a fever or think you have an infection. Third, cyclosporine can cause your blood pressure to rise. It's important to have your blood pressure checked on a regular basis. And finally, there are several prescription medications that are not safe to take with cyclosporine. Discuss any new medication with your doctor or pharmacist. Some people can feel sick to their stomach, bloated, have stomach pain, or develop diarrhea when they take cyclosporine. Let your doctor know if this becomes a problem. Cyclosporine can affect your kidneys. Your kidneys are watched through regular blood and urine testing. It's good to drink 8 to 10 glasses of water a day to flush your kidneys. Cyclosporine can also rarely irritate the liver. Now this is monitored through regular blood testing. Cyclosporine can cause a number of other side effects, including fatigue, headache, increased hair growth on the face or arms, swelling of the gums, flushing, tingling in the fingers, toes, tip of the nose, tongue, or lips, weakness, and muscle cramps and tremors. Cyclosporine is not normally taken during pregnancy. If you become pregnant or are planning to become pregnant, let your doctor know. Finally, when used for long periods of time, cyclosporine may be associated with a small increased risk of lymphoma and skin cancer. You can discuss this with your doctor. If you're taking cyclosporine, you should call your doctor if you feel sick and you want to stop, if you're concerned about any side effects, or if you've stopped or want to stop the medication for any reason. Now for cyclosporine, there are a few other specific reasons to call your doctor. If your blood pressure becomes elevated, if you think you have a fever, or you think you have an infection, if you're pregnant or planning to get pregnant, if you develop a new severe headache, or if you're planning any surgery. I hope you found this video to be useful. For more information, please refer to our website at www.rheuminfo.com.
The pros. It can be used by pyoderma gangrenosum, dyshidrotic eczema, chronic urticaria, BC disease, pityriasis rubophilaris, dermatomyositis, pemphigovulgaris, epidermolysis bullosa acquisita, lichen planus, hidradenitis suppurativa, prurigo nodularis, systemic sclerosis. Pros and cons. Side effects from cyclosporine may include hypertension, which may require additional medication for control, a reduction in renal function, which may necessitate reducing the dose of cyclosporine or occasional stopping it, like the doctor said from the video before.
Hello, I'm Dr. John Singh, a neurologist and expert in myasthenia gravis. I
I'm also on the board of the Myasthenia Gravis Association of Kansas City. I've been talking with you about treatments for myasthenia gravis, and I will continue by talking about treatments that do alter the immune system to try to suppress the abnormal antibody that is made in myasthenia gravis that blocks the chemical communication between the nerve and muscles to cause the weakness that is myasthenia gravis. I will continue talking with you about another medication called cyclosporine. As we discussed earlier, cyclosporine and Cellcept came out of the organ transplant experience of the 1980s and 90s. And both of them are used in myasthenia gravis. So these often take a few weeks of treatment before they kick in and start working with myasthenia gravis. Cyclosporine is a medication that was one of the early ones that was actually FDA approved after an extensive trial in that medication. So it's known to be effective in myasthenia gravis. It is usually given twice a day with slowly increasing dosage and is usually well tolerated. However, it has one potential serious side effect, in that it does occasionally cause kidney damage. Because of this, frequent blood tests have to be done to monitor cyclosporine. We usually draw a blood level of cyclosporine just before you take your next dose. This is called a trough level. This allows us to better keep track of the level that's in your blood of cyclosporine on a regular basis. High trough levels are felt to be associated with increased risk of kidney damage. And we try to keep that trough level below a certain number. Cyclosporine can be used with all of the other medications that are used in myasthenia gravis and remains one of the second-line medications that are often used.
Issue in Ecuador. Preferably used in people that need organ transplant. It can also be used here in Ecuador for psoriasis, uveitis, and rheumatoid arthritis.
Success rates in solid organ transplantation continue to rise. Yet each measure of success brings with it a new set of challenges. Signaling the future, targeting co-stimulatory pathways. The quest to improve long-term outcomes begins with an exploration of the initial cascade of events that occurs within the immune system. Once an organ is transplanted, the body mounts an immune response against the allograft. T cells, which mediate the immune response, require two signals for full activation. Signal 1 is mediated through the T cell receptor's engagement with the antigen presented by the MHC on the APC. Signal 2, the co-stimulatory signal, results from receptor-ligand interactions that occur between the T cells and the APC. This co-stimulation enables T cells to proliferate and mount a sustained response to the allograft. Although current immunosuppressive therapies, such as calcineurin inhibitors and mTOR inhibitors, work to prevent T cell activation and/or proliferation, their targets are not specific to the immune system and may be associated with therapy-related toxicities that may compromise long-term graft and patient outcomes. To meet the current challenge of reducing toxicities and prolonging graft and patient survival, selective agents are needed. While multiple pathways are currently being investigated for the development of immunoselective agents, CD28 is one of the best characterized receptors required for co-stimulation. By preventing CD28 from interacting with CD8086 on the APC, signal 2 is blocked, and the T cell is rendered anergic or apoptotic. Since CD28 is expressed predominantly on T cells, this pathway offers the potential for immunoselectivity, possibly reducing the toxicities that may be associated with less immunoselective agents. Co-stimulation blockade via inhibition of the CD28 pathway is a therapeutic approach with the potential to improve long-term graft and patient